Good evening, everyone, and thank you for joining us on our first Facebook Live event. Now, we're facing a lot of new challenges and uncertainty right now, so we wanted to take an opportunity to share some information with you and answer some of your questions. I'm joined tonight with City Manager Cindy Roth, our Fire Chief and Head of Emergency Management, Chief Jeff Johnson, and our Acting Director of Peninsula Health District, Dr. Steve Julian. Now, each one of us is going to provide a brief update, and then we'll respond to some of the questions that you may have that you're posting on your messages. Now, you can go ahead and start posting questions now and keep them coming. Tonight's focus is on the coronavirus and the city's response. Now, I know many of you have questions about schools and your child's education. We won't be addressing those questions this evening. Next week, however, Dr. George Parker will host a Facebook Live session to share information and respond to your questions and concerns. At the end of this session, we'll post contact information for the schools so you can reach out to them. And if you don't want to wait till next week, we will have sources on the television of their contact information. Every day we learn something new about the coronavirus and how to protect ourselves and our families. Now, I'm going to let our panel address new information and the specific activities that have taken place over the past few weeks. But first, though, as your mayor, I just wanted to say a few things to you. You know, I'm a son, I am a father, I am a grandfather, and so I understand the fears and concerns that you may have about your family members. Social distancing is hard, but it's so important, especially when it comes to older individuals and those who have some pre-existing conditions. You know, I have a mother that's 101 years old, and I haven't seen her in 3 weeks, and it's tough. But we're lucky to be able to use virtual resources and stay connected. Even though she's blind, she can at least hear my voice. Just like you've had some challenges and you've had to change in your lives, the city has had to make some changes also. Now, we've had some tough decisions to make, but they're all in the best interest of pursuit of your safety and the safety of your family. We're constantly monitoring the situation and regularly share information on our website, our social media, our newsletter, and on NNTV. Our 3-1 contact center is also available to answer your general questions. Now, there is a great deal of uncertainty with the coronavirus, and the information changes daily. So please, I urge you to make sure that you're listening to the reliable resources. Make sure that you're listening to the experts. Some information that you're getting may be challenging, so make sure your source is accurate and correct. And on that note, we're going to turn to our expert, Dr. Julian. Dr. Julian?
Good evening. First, let me thank Mayor Price for making arrangements for this opportunity to be with you tonight, and I welcome all of you who have joined us by Facebook Live. What I would like to say is that we are all in this together. We are in a state of interdependence. Americans are fiercely independent people, and that is a good thing. However, in this time, we need to understand that our actions significantly affect others. I want to say first off, wash your hands and do it for 20 seconds. 20 seconds sometimes can seem like an eternity, but it is important to do in everything that we are trying to do to bend the curve to prevent the spread of this disease. You can rest assured that your city leadership, your emergency medicine services, and your healthcare services here on the peninsula are doing a great job of working together to help you fight this virus, and that we can win this battle with this disease. We'll have a lot of opportunities to answer questions tonight. There are 4 websites that I have provided to the team here, and I'm going to refer you to those multiple times. They are great sources of good, reliable information on the web. And at this point, I would like to pass things over to Ms. Cindy Rolfe, City Manager. And thank you.
Thank you, Dr. Julian, and thank you to everyone for joining us this evening. As the mayor indicated, this is a difficult time for all of us. So I just wanted to take a few minutes to talk with you about some of the things that we are doing to ensure that your city government can remain operational and that we can meet the needs of our citizens during this uncertain time. In keeping with guidance from the governor and the Virginia Department of Health, Newport News city buildings and facilities are closed to the public and will remain closed until further notice. The governor ordered the closure of schools for the rest of the academic year, which we know is posing new challenges for families in our community. But I want to assure you that while city buildings are closed, we will continue to provide essential services. Our public safety employees are working and doing a tremendous job. We're continuing to provide services to our human services clients. We're taking actions to assist the homeless population. Building inspections are continuing, trash is being collected, and will continue to be collected. Now we know there are some of you that are disappointed that the Recovery Operations Center is closed, especially since you're using this time, your time at home, to clean or to tackle your yard work. However, our Public Works team is still collecting bulk waste. So you can put out those other items for collection, but please, only on your scheduled week for collection. The Peninsula Regional Animal Shelter remains open to reclaim pets or for adoptions, but they are asking if you want to adopt to please call and make an appointment so they can better manage your time at the shelter. Every effort is being made to ensure that your city government remains functional. And the only way that we have been able to maintain these services is through the hard work and ingenuity of all of our city employees. I am incredibly proud of the way that our city team has adapted so that they can continue to support our citizens. Our employees are really stepping up to the challenges, and we appreciate all that they do. But for more detailed information on city operations, please view our website or contact 311. And while this situation affects all of us, it is hitting small businesses and their employees especially hard. The governor mandated that all restaurants close for dining in, which impacts thousands of people in our city. We've been impressed with the way businesses have modified their operations and they're staying open and trying to keep employees employed. But we know you're struggling. Please know that your city supports you. Our development department is identifying resources and sharing information that will help during this very difficult time. Again, go to our website for this information. We're trying to post all the information in one place so that you have an easy reference for the sources that you need. And finally, our primary concern has been and will continue to be the health, safety, and well-being of our citizens and all of our employees. We all have to do our part to slow the spread of the coronavirus. Practice social distancing, stay home when possible, and wash your hands. As Dr. Julian said, we can and we will get through this together. Now I'd like to turn it over to Chief Johnson to share some more details about the city's emergency response and the Peninsula COVID Operations Center, which is currently being hosted in the Newport News Emergency Operations Center. Chief?
Thank you, City Manager. So there's several things that we are doing at the fire department with our paramedics and firefighters to ensure the safety of our citizens in this community. One of the things we're doing is an enhanced call screening. So when individuals feel like they are having difficulty breathing or some issue that they need to call 911 for, we're going to ask additional questions and try and find out if this may be a COVID-related incident for us. If it is, our members are taking additional precautions and measures. We're wearing enhanced personal protective equipment. And you may have heard of the N95 mask. It's a face mask that our individuals wear. We're wearing gowns with the gloves and face shields. So we will have an enhanced PPE that we'll be wearing when we arrive on the scene and begin treating any individuals that are calling 911. And then we're certainly still providing transport to the appropriate facilities within our community. We ask that if you are feeling ill, maybe your first stop, if you're not having shortness of breath, those type of things, it's not a life-threatening emergency, to call your physician's office and see if you can do a telemedicine, but talk with them before just arriving at the ER or to the urgent care clinic. We encourage you, if you are having difficulty breathing or anything like that, call 911 and we will be there and appropriately treat you and get you transported to the proper facility. As the manager mentioned, one of the things that we're doing that's exciting, and it's a collaborative effort here on the peninsula, is we have the Peninsula COVID Operations Center that we are hosting in our Newport News Emergency Operations Center. What that consists of is individuals from James City County, Williamsburg, Hampton, Poquoson, and Newport News. And what we're doing in York County, and what we're doing is we're working together collaborative as a group in an operations center. We have all of the hospital representatives are there. We're working with the Department of Health there. Dr. Julian is part of that group. And so we have daily conference calls. We're receiving data every day regarding the health of the peninsula. And it gives us a real-time look at what's going on here in the peninsula as a group, as a community. Some of the things that we can do if James City County or York County needed some assistance, we could provide them assistance. Likewise, if Newport News needed assistance, they could provide assistance. We're also looking at sharing resources. As many have heard, there is a shortage of the personal protective equipment. I can assure you that here on the peninsula, while some entities are getting lower in supply, others have a bigger supply. So we are sharing resources to make sure we are all providing personal protective equipment to our first responders, police officers, sheriffs, and other services that are responding and helping assist in our community. So again, if you're feeling ill and you're not short of breath, I would encourage you to call your physician's office. If you are short of breath, I'd encourage you to call 911 immediately, and we'll respond and we'll get there appropriately and take you to the proper facility. So at this time, I'd like to send it back over to Mayor Price.
Thank you. Thank the panel for these updates. Right now our communications department and our team is going to be monitoring the feed, and they will begin to ask us questions.
Daryl would like to know, can you share what actions we are taking to assist the population experiencing homelessness?
Yes, I'll take a first stab at that if I could. The governor, due to the restrictions, we're trying to protect people and our employees. So the Four Oaks Center has been closed, but we're still providing services. Staff is in the field. They're partnering with the Salvation Army and with Link to deliver food and supplies to the homeless individuals. We're also connecting people with medical providers and working with local healthcare organizations to provide screenings for them as well. We're distributing supplies, hand sanitizer, soap, sleeping bags, blankets, coats, and also we're utilizing a mobile van to do this. We're continuing to plan for additional services, including hand washing stations, showers, laundry services, and partnering with healthcare organizations as long as this virus is active. Volunteers are not needed at this time since the staff is in the field. Donations are not being accepted at the Four Oaks right now either. So if your church or organization would like to discuss donations or support, you can contact Quincy White, Executive Director of the Four Oaks, at whiteqa@nnva.gov. Anyone else want to add to that? Okay, next question, please.
Okay. Dr. Julian, is there any need for volunteers in the community to help with deliveries or any type of support?
I would say yes. You can reach out to your local volunteer agencies, would be the first response I would give. There is a great need right now for people who are seamstresses or have that tailor capability to develop masks that can be used in facilities. There are a number of opportunities of that nature. I'm certain that no hospital system or physician's office would turn down any help, but of course a person has to undergo the appropriate screening and training before that can happen. There's also the ability to volunteer at the food bank. So that would be a great a place for people to apply their skills and their time and energies. It would be much appreciated.
Not only volunteering, but bringing food with you when you do come. That would be good.
Exactly.
The shelves
Yeah,
are.
that's what I was going to ask.
There'll be folks in need.
Yeah,
that's for
absolutely.
sure.
And
Absolutely.
obviously blood drives, things like that.
Absolutely.
Something about the blood drive I might mention.
Yes, go ahead.
So we've been in touch with the Red Cross and working out methodologies to do that safely in the community. One of the reasons why the blood drives have been stopped is in relationship to the congregation of people. And so we've been in conversations from public health with the municipalities and with the American Red Cross of how to set up blood drives such that people have a proper social distancing. And so I want people to understand that blood is still needed, and so blood donation is welcomed and needed for our community, and I don't want that to be forgotten. And there's no evidence that there's any, if you're healthy otherwise, that there's any danger in donating blood as usual. And of course you will undergo appropriate screening before you do so. So keep that in mind and understand that people are working out ways to do that.
Good. Next question.
Do our city's first responders have the PPE they need?
So that's a great question, and we're getting that a lot. We do have the enough PPE for our first responders. We've placed orders like all the other systems have, the hospital systems and other state systems. So we are in line for an order of supplies, but fortunately we had a fairly large stockpile of PPE on hand that we've been able to hand out, and we still have a fairly good supply. So we do have PPE. Appreciate the question. We get that a lot, but our members, again, police, fire, EMS, the sheriff department, we're all sharing, and everyone does have enough at this point in time.
Chief, just to piggyback on that, the Peninsula Dental Society sent out a blast to the dentists in the area if they had extra, because we're not using as much as we normally would, and we've asked them to drop by the sheriff's office to donate those until we get back to full time and then replenish our services. So you may see some more coming in. We hope so.
That'd be good.
Yeah.
I might add too that which we have received from the strategic stockpile has been rapidly distributed through appropriate mechanisms. Additionally, we are having community members, citizens, call us who have connections with companies overseas that manufacture PPE, and we are following up on those leads, providing information to the state procurement departments to see if there are avenues for additional supplies.
Great. Next question.
I want to support the restaurants that are staying open, but is it safe to get takeout?
Well, the information that we have on that is that that is a safe thing to do. There was some confusion a few days ago about, could you go inside the restaurant to pick up your food? And the guidance that we have on that is that it is okay to go inside the restaurant to pick up your food. We've actually noticed some restaurants are putting tape on the floor about 6 feet apart, so that when people are standing in line to pick up their food, that they're keeping a proper social distancing. Restaurants certainly deserve our patronage, and it's certainly a great resource for us in the community, and there appears to be that is a safe process at the present time.
If I may, Mr. Mayor, I'd like to just reiterate and encourage the public, if you feel comfortable, please support all of our local businesses, particularly our restaurants. They really need your help and support right now.
Can I still go to the park to get some fresh air?
Absolutely.
Yeah, the answer to that is absolutely yes. But when you go, again, use good common sense. So the virus can live on surfaces. We don't know how long exactly on all surfaces. The research is scanty at present, but we know that it can. And even when it lives on surfaces, we do not know how infective it can be and over what period of time, because we simply haven't had enough time to understand the spread and the danger. But It's perfectly fine. Keep your social distancing. Remember to wash your hands still. Use the Purell and the hand sanitizers as necessary. And remember that, surfaces that other people have touched, you need to be cognizant of them and wash your hands between those episodes. It's probably very good for you emotionally, spiritually, and socially to get out. And with the springtime coming, I would encourage everybody to do so. I think it would be good for your health.
Has there been any coordination with FEMA regarding the development of temporary hospitals?
The answer to that is yes. The Virginia Emergency Management Division has coordinated with both the military and with FEMA, and that is in process to use as we need. It is a extremely well coordinated activity at the present time. I would piggyback off of that to say that I'm really gratified by how well coordinated our emergency medicine services are in the region. You've heard about the Emergency Operations Center based here in Newport News. And all the hospital systems are working hand in hand, as well as the private physicians and private physician groups. I think the public can feel really good about how well things are coordinated here on the peninsula.
And I would add to that, the question about FEMA and their response to the area. It's been very well coordinated so far. They've really been providing a lot of information. VDEM, which is the Virginia Department of Emergency Management, as the doctor mentioned, has been really good at communicating to us. And so right now, we've had a few people calling and wanting to know where the tents are or when they're going up, those sort of things. And the hospitals have a capacity, a surge capacity built within. So while the hospitals are not full yet, even when they start to reach that full, they have the ability to expand their beds. So those type of things are going to occur before we start seeing mobile field hospitals set up. But the planning is taking place right now. We know that the Army Corps of Engineers is on the peninsula and on the south side looking at locations potentially if they were to stand up a field hospital. We know the hospitals are looking at taking one of their buildings and potentially making it more of a wellness clinic, and so the more sick patients would be transported to the hospital. So there's a lot of things that are going on, and the Virginia Department of Health, Virginia Department of Emergency Management, FEMA, and all the resources here on the peninsula are working really well through our unified command and making sure we're aware of what's going on out there. So that's a great question. There is a lot going on, a lot of planning.
Okay.
All right. Jason would like to know, when do you foresee the peak number of patients for this event?
I'll be glad to take that one. So what I want people to understand is that when you're dealing with a pandemic for an infectious disease such as COVID-19, the increase in the number of cases that are identified occurs in an exponential fashion. So it doesn't go up in a linear fashion in terms of reporting of cases. There's a great YouTube video that I will give to the host at the end of this communication so that people can go out and look. It's an 8-minute video. It explains extremely well about how a pandemic can be a stealth problem in the sense that it doesn't appear to be serious until it all of a sudden is. And there's a mathematical reason for that with the spread of epidemics or viral illnesses, infectious illnesses in a population in a pandemic situation. So what people need to understand is that over the next few weeks, we're going to have more cases. I'm sad to say we're probably going to have more fatalities. This is to be expected despite all of our activities. But it also points out that while all of these actions that may feel draconian and may feel as if we are limiting our lifestyle and our activity, have a really good reason. And the reason is to bend the curve down, the up and down curve that is characteristic of pandemics. If you take a look at the curves that occurred in China, look at what happened in Italy, and then look what happened in Singapore and in South Korea. Where we want to be as a community and a country is closer to Singapore and South Korea, maybe China. What we do not want to be is this high peak with a large number of cases happening extremely rapidly and with many deaths. And the way we bend that curve down and the way we improve our chances of going through this with the minimal amount of impact on our citizens is by doing all the simple things that we talk about. Social distancing, hand washing. If you are sick, do not go out. Contact your healthcare provider by phone. With your family and friends, use FaceTime and things, Facebook and things of that nature. Please follow the advice of your medical professionals. This is a time for us to all come together and realize that we can beat this, we can defeat this problem, but it is going to require us to do all of those things, which are a bit uncomfortable, a bit out of our comfort zone, but in the long run will help us overcome this illness.
Thank you.
We've received a few comments from employees asking if the city is going to close to employees. Michael asked if any aspects of the city workforce are able to telework. So Cindy, would you please share some of the things the city is doing to keep employees safe?
Yes, the city, as I indicated earlier, has closed until further notice. We have done everything that we possibly can to limit the number of employees that have to come in by, as I mentioned in my comments, some ingenuity. We are finding different ways to provide our services. People are telecommuting. We are looking at any ways possible we've done curbside service for some areas. But as I said, there are some very essential services that we have to provide, and they do require some of our employees to come in. But in every opportunity that we have to minimize the number of people that have to be into our buildings, I think in some of our departments, probably the largest percentages are no longer coming into the office, and I've been extremely pleased the way we've still been able to maintain some of our services. We're changing shifts around, we're altering those to limit the amount of time. We're of course following all the guidelines that have been set forward in terms of any interaction and social distancing. I don't think over the course of the last week or two I have been on so many conference calls with different employees, and just as late as yesterday, probably 25 of your department directors were on a conference call providing information and making sure that we can continue the city operations for all of our citizens. Our human services are probably the most customer serving group within the city have done some really innovative things and offered some services that but they do have some requirements that they have to do to reach out into the community. They do have some responsibilities, and they're continuing to do those responsibilities.
Great.
All right, Brett with Wavy TV has tuned in, and he is asking, are there actions being taken to prepare for the possible decline in tax revenue to the city, and will public works projects be put on hold?
Thank you. Absolutely. We have spent probably the last 2 weeks we're scheduled to present what we thought and still think was an excellent budget to council last week. Given the circumstances, we've had to step back. I've had numerous meetings, including with the mayor, just to give him some idea of what we are seeing from our finances, just to make sure that we end up in the black in the current year. We've done some things with hiring freezes going forward. We're looking at all expenses. We've talked to the department saying if it's not critical or something that you need right now, please don't move forward with it. We're looking at our capital projects, and we're also stepping back now and reducing some of our estimates for revenue for fiscal year 21. So we are taking into consideration, we are daily looking at the numbers. Our budget folks look at our revenues on a daily basis. Our financial staff has been running numbers and doing scenarios from best case to worst case. So we are on top of it, but it's a very fluid situation. But unfortunately, the budget we originally started out with that wanted to present won't be exactly what we had hoped to do, and we may not be able to do some of our new initiatives, or we may have to push them back till we have a better idea of what our revenues are going to look like. But we won't have a better sense even for this fiscal year until later, a few months later, and into next year, probably latter part of the new fiscal year. But we are continuously monitoring it.
And if I could add to that, I was extremely impressed with our budget director and our finance director and our city manager as they discussed the various scenarios and outcomes that were possible, I'm extremely happy with the projections that you made, and whether or not, if this happens, what we would have to do. So I feel very comfortable that we'll be able to handle anything as far as the city with what the preparation we've done thus far with that.
Thank you, and I can't stress enough, over the past years, there has been strong financial management of the city, and we have a very strong financial position to be able to weather this, but we will have to go through a few challenges.
Next question.
Zach would like to know, are there local clinical laboratories that are testing for the virus?
I'll take that one. At the present time, Riverside and Centera are working on their own testing. Not available yet, but they're working on it. There are some local businesses that are partnering with the healthcare systems here to bring this to bear as soon as possible. At the present time, a test can be sent to the state lab in Richmond and also to private labs that provide services in the area. Those labs are national labs, they're not here locally, but I can tell you that there's a great deal of interest, activity, and desire to be able to develop these here locally.
Are codes offices open so I can get a permit?
Codes, I wouldn't say necessarily the codes offices are open for say physically, but there are opportunities online to do permit applications. As I mentioned, we're utilizing every opportunity online. We have seen some uptick. You can get your permit. Inspections are still being done in terms of from our building inspectors. We have halted some of our housing inspections. We're just looking at doing issues that related to public safety. Folks are not going out from the housing inspectors to go out and just do their general community maintenance type efforts, but you can get a permit. We're encouraging people to use the online resources that are available, but they are open for business, so to speak, even though you can't go into the office directly.
All right. I was around someone who was coughing, and I think they may be sick. Should I be tested?
The answer to that is really found in the following pattern of thought. So first off, assess whether you develop symptoms, cough, shortness of breath, or fever. The second thing is, if you have a concern, contact your healthcare professional. Best to do so right now by phone. I would not run to the emergency room. I'm glad somebody brought up the question about testing. Testing is important to be done in individuals who are appropriately evaluated by their healthcare professional and they are symptomatic, or in a high-risk group who, upon evaluation by the healthcare professional, warrants testing. To run out and do testing on every person scientifically makes no sense at all. Think about it just a moment. Let's say I test you today and you're COVID negative. What about next week? There's no guarantee that you won't be COVID positive next week. The way in which this needs to be managed is to test those people who are evaluated by medical professionals and decided that it is appropriate to do so. It is not, and that's the other thing I'd like to add. You've heard about, quote, drive-through testing. I would like to try to help change your attitude and your thought about that. It's really drive-through screening. That's what these processes are that have been set up at some of the local hospitals. You need to be screened as to whether or not you have risk factors and symptoms consistent with COVID-19. And then once you've been screened, a medical professional will decide whether it's appropriate for you to be tested. That is the way it actually always works. And I think at this time, we need to educate each other and communicate to each other that that is the appropriate way to apply the testing capability.
Okay, great. Next question.
All right, Chief, we have a question for you. Are first responders changing how they engage with people on calls and interact?
So we are. We've always preached to our individuals, our medics, when they're on scene, to do a really good history and background of individuals. And so we're re-emphasizing that again. When the COVID was becoming more prevalent in the world, and then the fears that was coming to the U.S., some of the initial questions were, have you traveled abroad? And really that's no longer pertinent to us anymore. And so when we're engaging, we're really digging deeper into personal history to see if there is some relation. Have you been interacted with someone that has been tested and came out positive, or really a good physical assessment, because it's really a lower respiratory issue and it's in the lungs, and we can see some decreased oxygen saturations and shortness of breath, and there's other signs that someone could exhibit. The difficulty of it is sometimes it can be the flu, and so it's really a good screening. In the way we interact with the members of our community, as I mentioned at the beginning, is we are now wearing a more advanced personal protective equipment. And that is for the protection of our public safety employees and for the citizens that we are trying to treat. We want to make sure that we are not spreading the virus to others. And so we're using this protective equipment, coming in and doing a really good screening. And then when the call is over, once we have transported somebody, if they're transported to the appropriate facility, then our members are going through a decon process and preparing for the next run with a new set of PPE. And so we are engaging a lot of the similar ways, but we are spending a little more time making sure that we are prepared with our personal protective equipment and making sure that we are getting a good screening and background on the individuals that called the 911 system. So we are.
I would agree with the chief. I would just like to add, years ago when I was in medical school, I remember being taught that if you're well educated and you take a good history, the patient will tell you what's wrong with them. And then if you do the physical exam, you will find the signs and symptoms. And then if you do the appropriate laboratory testing, you'll be able to take good care of your patient. So I totally agree with the chief. Extremely important. Sometimes I think people say, well, why are they asking me all these questions? Or why, I've already been asked these questions by someone else. Please be patient with that, because what people are trying to do in asking you these questions is ascertain your risks, your symptoms, and then know where to look in a physical exam to help to take good care of you. And so I can't agree more with the chief. That's extremely important.
All right. Dr. Julian, Brett Hall with Wavy has a question for you. Are the cases at Newport News Shipyard counted in the Newport News city total cases, or are they counted by the city in which they reside?
So the way the epidemiology works is the cases are counted by where the person resides. And so that's how we tally them, and that's what you're seeing on the VDH website.
Okay. All right. Cindy, someone is asking about library fines. They know the library's closed. Are they incurring fines?
They are not. The libraries are closed, and they're doing a lot of things online also, but they are forgiving those fines for the books at the library.
All right. Gary has a question about the Sheriff's Department. So has the Sheriff's Department suspended the weekend program, and is the jail following social distancing inside the jail itself and its workforce, i.e. work release?
I think I would have to get back to you on any specifics. I know that the sheriff has been very engaged. I don't believe they are still doing some of the weekend work, but I'm not sure in terms of what's their operations, but I'd be happy to give more information.
I have a little bit of information on that.
Okay, great.
And from the EOC, our Emergency Operations Center's calls, the jails and the Sheriff's Department are part of those calls, and we have been gratified at how diligent they have been to assure appropriate social distancing and appropriate PPE use in management of all of their people that are in charge of.
All right. Is it mandated that stores open early for seniors?
I am not.
No, I'm not aware of any mandates
Yeah.
for stores to open. I'm certainly sure everyone appreciates when they do that for opening early for seniors or for people that are at risk, but there is no mandate.
All right. And somebody has a weekly book group that only has 5 people in it. Is it still safe to have her book club?
That is probably a very good question, and I would say this. We talk about not gathering in groups larger than 10. However, I have no idea of the age or travel or any of the exposure or any of the history of the members of the book club. But I would say with a abundance of caution, I would encourage trying to do something like the book club by FaceTime in these circumstances. It certainly fits within the guidelines as long as you're social distancing, washing your hands, all the things that we've been talking about. However, I remember the old, some of us are old enough to remember the Fram oil filter commercials. And in those commercials, they would say, they'd hold up an oil filter and they would say, well, you can pay me now or you can pay me later. And but meaning that change the oil filter when you change your oil. And so I would caution us over the next few weeks, you're going to see a significant rise in the number of cases. We're going to see likely a significant rise in the number of fatalities. And out of an abundance of precaution, I would just ask everyone to sort of reassess, is this something that can be done video? And is it something that we can do in that manner and really try to get this disease stopped?
All right, and Dr. Julian, Zach is asking about treatments for coronavirus. Are there any viable options right now that you're familiar with?
That's a great question, and I understand the etiology of that question. Let me say it this way: there are no great treatments specific to coronavirus. The treatments that are being applied now are supportive treatments. We do not have a magic pill. We do not have a vaccine. And in saying that, 2 things. One, please know that in the United States, and certainly here on the peninsula, we have the best acute care medical system in the world. There is none to match it. I think we could, in general, do a little bit better with public health and preventative care throughout the lifetime of our patients. But as far as acute medical care, no better place in the world to be. There are a number of trials going on right now with a number of medications, but there is no specific medication that is specific for this disease at the present time. That's why it is so important that we do all the measures that I've been talking about in terms of bending the curve and in terms of preventing the spread. This disease is spread by droplets between people, and that is the main thing that we've got to prevent at this time.
All right. Chief, you've spoken about how Newport News is working with other municipalities, but someone wants to know really specifically how we're working with other cities to monitor the spread.
So what we are doing is we've actually set up some database that has been designed and built by members of our fire department and the communities around us. And sitting in a room, one of the first things we did at the EOC was start talking about what's an important piece of information to know for us about this virus, the potential spread within the communities, and what can we share as far as based on that information in regards to resources, supplies, and those type of things. And so we get a report every day from the previous 24 hours from every one of our transports, and it's all of the communities around here. Again, James City, York County, Williamsburg, Hampton, and ourselves, and Poquoson. When we do a transport, if we suspect potentially a COVID-19 patient or exhibiting some of those signs and symptoms, and we are utilizing our additional protective equipment, then we're actually checking a box that we have built, and what it's doing is giving us a report every morning of the previous 24 hours of how many times that's occurred. And what we're doing is we're sitting in a room with all those agencies And we're pulling all that data together, and we're looking and seeing how many times in the past 24 hours did Newport News have to utilize additional protective equipment. James City County, York County, Hampton, Poquoson, Williamsburg. How often do we have to do it? And as we start seeing those numbers tick up, we can work with each other to make sure, one, that we're sharing resources, and that includes our personnel and our units. If there's not an ambulance available, or they're down to a few number of ambulances in another one of the communities, we'll send a medic unit over there to help provide coverage. Likewise, those cities are all going to help provide coverage to us as well. When we start looking at the times, number of times a day that we're utilizing that personal protective equipment, we can figure a what we call burn rate. We have so much in stock, and based on what we're using per day, that stock will last X amount of time. Each entity has that. Now everyone knows how much stock each of us have. And so when we have some entities that are burning through it a little bit faster and they're getting a lower supply, we can provide some additional supply to them. And likewise, when if we start utilizing it more, they can provide additional supply to us. So really what we have created is really a joint information center up at our EOC, and every day we're analyzing what the fire and EMS are doing within each of the communities, what the hospitals are seeing, and looking at the data points and trying to follow those lines to make sure we have resources, personnel, and equipment for everyone.
Great.
All right, Dr. Julian, Kayla would like to know, is there any prediction on how long the virus will last and when it will reach a peak in the Hampton Roads area? And is it seasonal, and will it come back next year?
So those are great questions, and I understand why you're asking. The problem with this virus is you may remember when it was first being talked about a few months ago, it's a novel coronavirus. Coronaviruses are in the class of viruses that cause the common cold. The problem with this one is it is a mutated virus, and instead of having a propensity for attachment to the lining surfaces of the nose, sinuses, eyes, that's why you get the runny nose, the sore throat, so forth with the common cold, the headache. This one has a propensity to settle out in the lungs. So we are learning right now. So that is the circumstance. We do not know what the course of this disease will be. That's why we keep saying, and I'll say it maybe one more time, why we're doing all the things that we're doing in draconian actions to decrease travel, to decrease communication and interaction between people, social distancing, et cetera, washing your hands, because we're trying to decrease that curve. Now, one other thing is happening right now. It is springtime, and of course people have seasonal allergies, and some of those symptomatologies very similarly overlap the symptoms that people are presenting with the coronavirus. The other thing is, since this is the first year that we've had the coronavirus to deal with, we do not know if it is going to disappear or go out of the population as the influenza virus generally does. You know, that comes on in the fall, is a problem in the winter, and usually burns itself out in the spring. But at this point in time, we do not have a history with this virus. We do not know. The one other thing that we have to keep in mind, and it's another reason why all these things we're talking about is so important, is that a lot of people don't realize it, but with influenza can be a bimodal illness. And by a bimodal illness, what I mean is that you'll have early in the season, starting in the fall, often around December, around Christmas time, you will have a rise in cases. If you looked at the epidemiology of the regular influenza, it looks very similar to COVID-19. What happens is it will go up, say in December, as I said, and then it will drop. And in January, maybe 6 or 8 weeks, there are fewer cases coming into the emergency room, maybe we're over this. And what can often happen is you'll see a second peak sometime in the February, March timeframe. And so that's really important to understand that may happen with this virus. It does not seem to be happening in the other countries of the world. That's a good thing, but we do not know at this time. So there's no way to predict when we're going to be out of this. Everyone is very reluctant to say, when are we going to be over this? When can we quit worrying? Because I think honestly, we don't know. But we do have historical perspective from this current outbreak. Look at China. Things started in December. They seem to peaked out after about 2.5 months, and they seem to be dropping down. And so it probably runs a natural course of at least 3 or 4 months. I would not be surprised if it were longer. And we in the medical professions will be looking to see if we see a bimodal distribution, as I have described. So we're all learning this right now, and the last thing I'll say is, I think the difficult thing for the public to see is that this is how medicine and treatment of disease is learned in real time. Emergency medicine professionals, doctors, nurses, we all know that this is how you learn how to take care of diseases. I think back, and this is not dissimilar from HIV. This is not, and many of us are not old enough to remember, but this is very similar to the polio epidemics of the 1950s, and this is extremely similar to the Spanish flu pandemic of the early part of the century, the last century. So it's very important that we understand we're learning as we go, and we need to do those things that we know that will prevent the spread of this disease.
Okay.
All right. City council and school board elections are scheduled for May 5th. Are those still taking place?
Yes, as far as we know, those elections are still going on, and that's scheduled for May 5th. The state code allows a process of postponing elections for up to 2 weeks, and the local government, if they feel it needs to be longer, is required. They can petition the Virginia Supreme Court for an extension of no more than 30 days from the original date of the election. But the voter registrar's office is encouraging voting by absentee ballot by mail, and using where you would normally check my disability or illness reason on the application. The coronavirus would qualify for that this time. So those who wish to vote absentee in person, the registrar's office is offering a curbside voting, and you can call the voter registrar's office for information at 926-8683. And the deadline to register or update the registrations for the May 5th general election is Monday, April the 13th, and the deadline to request an absentee ballot by mail is 5 p.m. Tuesday, April the 28th. Thank you.
All right. Why did the city close playgrounds?
You want to answer that? My guess is the touching of the equipment and whatnot.
Yes, it has to do with the spread of the disease in a population, and it is a wise action to take. It's really hard to clean those things adequately between people, and it's out of an abundance of precaution. I think that's the main thing that folks ought to understand.
And let me piggyback on that, because I've been asked a question about why are some golf courses able to remain. They're adults, most people who are playing that, so they know not to touch, when to touch, and they're doing precautions. So they'll raise the cup so you don't have to reach in and get a ball. You're not allowed to take the stick out. They've taken the rakes out of the trap so you don't touch them. They disinfect every golf cart, and you're one person to a golf cart at most of the golf courses. That's why they're being allowed to continue.
All right. Michael would like to know, how many tests does the Peninsula Health District have on standby?
That's a great question. So that's one of the things that a lot of people do not understand about the situation, so let me explain. So the Virginia Department of Health and the Peninsula Health Department does not do testing. We do not have tests. The tests are available at your private physician's offices, or they're available at the hospitals with the health systems. The number of tests available is information that the hospitals have, and they update me on it about weekly. And so their supplies are low, but as you see, they've been doing the drive-through screenings and have the tests available. So that's the story on that.
Are the grocery stores going to be closing?
I would say no, they're not going to. That's an essential. That's one of the things the governor, when they close things, they may limit the number of people that go in. You will also notice that the carts are being wiped down at most grocery stores. If you're like me, and Doc, you can let me know if this is that. I carry my own wipes when I go out if I have to. touching doors, wiping down the gas hose, just to protect yourself. Keep some hand sanitizer in your car when you do get back in. That's the first thing I would do is use that as well. So you've got to protect yourself because you can't depend on other people having the same good habits.
Mayor, I would totally agree. A couple of things that you said, I will tell you that for the last 2 or 3 years, I've had a pair of gloves in the trunk of my car, and whenever I get gas, I use those gloves when I do that. I certainly hope that the grocery stores are not going to close, because that would be distressing to me,
Absolutely.
as distressing as this problem, because I like to eat. But all jokes aside, it's really important that you maintain good nutrition throughout this, because our immune system is what we're counting on to help as the main defense against this disease. And by poor diet, poor nutrition, poor immune system. So we want to stay appropriate in that area. I do not see any reason to want the grocery stores to close. We have had conversations with various grocery stores in the area about how to sanitize frequently their equipment supplies, where you get the handles on the doors, where you get the frozen foods out, and so forth and so on. So.
All right, this is the last question, and it's actually a group question, so each person gets to answer. What is your advice for citizens?
I'll start that if you don't mind. My advice is to be assured that this, with proper following the rules that we've talked about today, that we will get through this. Make sure that you wash your hands, as the doctor said, 20 seconds. One person said sing happy birthday to yourself twice. That's about 20 seconds maybe. And do keep distance from people. As the doctor has said, this is something that is droplet carried. It may stay in the air for a little while if the particles are extremely small, but I think if you're staying 6 feet apart, if you cough into a handkerchief or your sleeve, and we'll let somebody else go.
So I would add, there's several things I think. Again, if you're concerned about your health, contact your primary care physician's office and have a discussion with them. Right now, the media, 24 hours, 7 days a week, it is all about this virus and how bad it is. And it does get people really concerned that they just don't feel well or whatever, and they're afraid they may have it, or they know someone that's got it. I would encourage people, again, if you're not feeling well, reach out to your physician by phone call and have that conversation with them. I would also suggest turning off the news for a little while. Just get away from it for a little bit, because just hearing it continues to upset people. We've had calls to our system, and we've arrived there, and someone saw something on one of the news channels about a symptom, and they think they have that, don't know if they have it. I think it's a good idea to watch some other forms of entertainment, or turn TV off and spend time with the family and relax, and know that the city is here working for you. The professionals out in the field, police, fire, and public safety, medics, we're there. We've got equipment. We'll be there to assist you. Our healthcare system is working hard to make sure that they can meet the capacity. So I would encourage everyone to take a step back from some of the media. If you're not feeling well, reach out to your physicians, eat some fruit, play a game, and enjoy your day a little bit.
Anything, Cindy?
I will piggyback a little bit on what the chief has said. Step back a little bit from it, but do keep yourself informed. There's a variety of sources out there, whether it's about city services or whether it's issues about health-related services. Utilize those resources when you can. Listen to the professionals. Be smart. Be safe. And as we've said earlier, we are going to get through this. It may take longer than we had hoped, but we will get through it. But please listen to the professionals. They're trying to act in our best interest.
And I want to thank you for tuning in this evening. I do want to piggyback on that last question, though, especially for the younger children, making sure that they're not, the kids are very observant. So make sure that they're not listening to this, and because it's going to be potentially scary for them to hear this all day. So you had some great questions. I want to thank you for those questions. I know we couldn't get to every question, so we'll be posting responses on the feed in the coming days, and you can also call 311 Center with general questions that you may have. Now, this is the first of a series of that we're going to do on Facebook Live events, and we're going to be doing this weekly. Next week's session will be, as we said before, the Newport News Public Schools, and in future sessions we're going to have community resources, healthcare responses, and also some business tools to help you in your business. If there are specific topics that you'd like to cover, please leave your ideas in the comment section so that we can address those as well. Now, the next few weeks are going to be difficult and possibly months, but as been stated, we can get through this. So we want you to know that things are different. You're probably around people more, even your loved ones, more than you normally are. Please be kind to one another. Mm-hmm. Be patient, especially with your children. We've seen some very interesting broadcasts about parents now around their kids and forgiving teachers for what they go through because they now are experiencing that. But let's just be careful, stay safe. Dr. Julian, you want to go through one more time some reminders of how we can stop the spread of this virus?
Yes, social distancing, 6 feet. Please cover your cough. If you're sick, do not go out. Call your healthcare professional. If you know someone else that's sick, please do not go around them. Washing your hands, using of the hand sanitizers. All of these are important measures. You know, we've been through a divisive time in this country in the last few years. I think it was President Obama who said, never waste a good crisis. And I've been thinking about that quote a lot. This is a great opportunity for us to come together, to understand how interdependent we are and how our actions and interactions with other people really matter and have a huge downstream effect. This is a stressful time. If you need mental health services, please reach out to the resources that we have. I'm absolutely certain we will get through this. I am gratified, especially in our region, by how well everyone is cooperating and working together. And I can reassure you that the public in the area, that the health systems are doing everything they can to decrease the spread of this disease and to take good care of you if you happen to come down with it. So I want to thank the mayor and other city officials for allowing me to be part of this tonight. And I want you to rest assured that you're in good hands. Please help us help you.
Thank you, Doc. Those are some very wise words. I want to thank the panel. Cindy, thank you. Chief and Dr. Julian, we thank you very much. Thank you for tuning in. Take care of yourselves and look out for one another. Good night.